In the last video, we talked about how migraine can result in a hypercoagulable state. In this video, we're going to talk about something similar, but also introduce the concept of Virchow's Triad. Now, what is Virchow's Triad? It's a framework explaining why unwanted clots or thrombosis can form in your vessels. So there are three factors in Virchow's Triad, hence Triad, and when one or more of these factors are present, the risk of developing thrombosis increases significantly. So this is an important concept. It's an important framework to know across all medical specialties, and it actually matters with migraine as well. And I'll explain why in this video. Now, what are the three factors that may be responsible for forming a clot according to Virchow's Triad? Well, the first one, which we talked about in the last video, is a hypercoagulable state. So blood that clots too easily. The second factor is disruption in blood flow. So anything other than the normal laminar flow that occurs in a blood vessel. So if there's turbulence, if there's stasis, if there's irregular blood flow like with AFib patients, that's not good. We want normal, regular, laminar flow, or else it puts patients at a higher risk of developing a blood clot. So disruption in blood flow. The third factor is endothelial cell injury. So we introduced what endothelial cells were in the last video. And so basically it's just an injury to the lining of the vessel. So if we have a blood vessel here, we have endothelial cells here lining the blood vessel. So damage to these cells is an endothelial cell injury and is a factor that can promote thrombosis. So if any of these elements are off balance, you don't need all of them, but if anyone is off balance, clots can form where they shouldn't. This is why AFib patients, atrial fibrillation patients, can develop stroke because of a disruption in blood flow. So Virchow's Triad increases stroke risk. So let's start with the hypercoagulable state. Now, this was talked about in excess in the last video, but let's just summarize it in this video. So hypercoagulable state occurs when blood is primed to clot more than normal. And why is this? It's because there is an increase in procoagulant factors versus anticoagulant factors. So procoagulant greater than anticoagulant. So again, like we talked about in the last video, migraine patients, especially migraine with aura, often exhibit this imbalance. Again, for more details, watch the last video, right before this one. But just for a quick summary, what does this mean in regards to the hypercoagulable state? There's an increase in factor 8, just a quick summary. There's an increase in fibrinogen, which we talked about. There's an increase in inflammation and stress, which results in an increase in coagulants. And otherwise, it increases the proclotting tendency. But this is actually not all, because treatments, especially when it comes to migraine, can also result in a hypercoagulable state. And what treatment can that be? Well, hormonal contraceptives. This is frequently taken for menstrual migraine, and so it adds another layer of risk by increasing clotting factor production. So the combination of migraine with aura and hormonal contraceptives really increases this factor in Virchow's Triad. So it's important to pay attention to thrombosis risk if on hormonal contraception. Now let's talk about disruption in blood flow. And we talked about this a bit earlier. Laminar flow is the normal, and anything other than laminar flow is a disruption. So normally blood flows smoothly through the vessels, like a calm river. It keeps the clotting factors, and again, if you don't know what clotting factors are, see the previous video. But clotting factors are flowing through the blood, they're dispersed, they're inactive, right? There's no letter A after them. But when blood flow is disrupted, either by a complete stasis and otherwise slowing down, or if it becomes turbulent, those factors can cluster and trigger clots. Now, what happens during a migraine? Well, during a migraine, there's vasoconstriction. So the blood vessel will vasoconstrict, and then it will vasodilate. this results in turbulence or a temporary stasis, especially in the brain. Furthermore, in migraine with aura, again, there is cortical spreading depression. I have a video on this as well. So cortical spreading depression is a wave of brain activity, but it also disrupts cerebral blood flow. So it actually triggers a vascular response. So again, with cortical spreading depression, we also have a period of vasoconstriction followed by a vasodilation. This is shortened and this is prolonged in cortical spreading depression. But that's not all. Cortical spreading depression also provides us with a wave of hyperemia. Hyperemia is increased blood flow followed by allogemia, and allogemia is reduced blood flow. So as this wave of activity spreads across the cortex, we have an increase of blood flow and then a reduction of blood flow. What does this result in? Turbulence. It results in turbulence in the blood vessel. And it makes sense, right? If water is flowing through a pipe at a steady velocity, there's no turbulence. Everything is calm. However, when the amount of water suddenly decreases, there's a bit of turbulence that occurs. And so same thing in the brain vessels. So cortical spreading depression creates turbulence. Turbulence, not good. Stasis, not good. We want normal, steady, laminar flow. And stasis, represented by these lines here, is actually what increases risk during a long flight. Keeping blood pooled in the legs for a long period of time increases risk of blood clotting. Hence, why Virchow's triad is incredibly important to know. So if you have migraine, especially migraine with aura, recognizing this risk is important. And it's not only about long flights. Chronic migraine patients may move less due to pain or the fear of even triggering attacks. It's called the cephalalgia phobia. There's anxiety with movement. Many migraine patients experience this. And this reduced movement results in a disruption of blood flow, which may also increase clotting risk. So the psychological aspect of migraine, the anticipatory anxiety of developing a migraine attack, can lead to an increased risk of clotting. Finally, we have endothelial cell injury. So as I stated earlier, your blood vessel is lined with endothelial cells. It's a protective layer that hides clotting triggers like collagen. Again, see the video right before this. Now, when this lining is damaged, clotting triggers are exposed and protective factors diminish. Again, with migraine, especially, again, migraine with aura, the endothelium functions poorly. There's repeated vessel spasms, inflammation, stress during attacks. And we also know there's an increase in von Willebrand factor. This should be under hypercoagulable state, but because of endothelial cell injury, that's when von Willebrand factor is exposed. So you need endothelial cell injury for the increased von Willebrand factor to matter. Because even though some von Willebrand factor are in the platelets, most are actually contained inside the endothelial cells. So when you have injury to the endothelial cells, you have the release of von Willebrand factor. And if you have increased von Willebrand factor in migraine, that results in an increased risk of clotting. Furthermore, an increased von Willebrand factor is actually a marker for endothelial stress. So high von Willebrand factor actually makes platelets stickier, thereby increasing clot formation. So at the end of the day, migraine isn't just a headache. It's a condition that causes a disruption in blood flow. It impacts vessel health, and it changes clotting tendencies. So by understanding Virchow's triad, we can uncover the risks and understand the opportunities for better migraine management. For example, with hormonal birth control, with anticipatory anxiety or cephalalgia phobia, so we don't develop blood stasis, venous stasis. Therefore, we may recommend things like movement to prevent stasis or careful medication choices. So these insights pave the way for safer migraine care.